Question says 64-year-old woman with non-history of myasthenia gravis comes to the emergency department with 2 days history of fever and worsening headache and neck pain. She was admitted to another hospital 8 days ago for myasthenic crisis precipitated by UTI. She was treated with ceftriaxone and intravenous immunoglobulins and discharged home 3 days ago to complete the course of oral antibiotics. Her other medical problems include hypertension, type 2 diabetes mellitus. Her medication includes metformin, uh, glyburide, hydrochlorothiazide, lisinopril, mycophenolate. The patient's temperature is 38.3 or 101. Blood pressure is normal, pulse 92, respiratory rate 16. She is awake and oriented. Moderate neck pain and stiffness is present. She moves all extremities to command and has symmetric dip tendon reflexes. The remainder of the examination shows no abnormalities. The labs are as follow. The hemoglobin looks fine. Leukocyte is elevated. The BUN create looks fine. Normal. CSF opening pressure is high. Glucose is low. Protein is high. Leukocytes are high, and that is neutrophil predominant. Red blood cells few. Cerebrospinal fluid gram stain and culture shows no organism. Cerebrospinal fluid cryptococcal antigen is negative. CT scan of head without contrast looks normal. Which of the following? So few options you can just eliminate by seeing the description, like subarachnoid hemorrhage. Here the CT scan is normal, so we can just rule out, because the CT scan of the head without contrast is very sensitive for subarachnoid hemorrhage, so we can just rule out this option. The second is the cryptococcal antigen, which says negative, so cryptococcal meningitis is very sensitive to the culture, and if antigen is negative, we can just rule out cryptococcal meningitis. Plus, for cryptococcal meningitis, patient should be in the immunosuppressed state. So we have aseptic viral meningitis, bacterial meningitis, or herpes simplex encephalitis. So these patients' clinical manifestations include fever, headache, neck stiffness, and CSF finding high opening pressure, neutrophilic leukocytosis, high protein, low glucose. All are concerning for bacterial meningitis. But here the question comes that the patient had the gram stain of the cerebrospinal fluid and culture shows no organism. How is that possible then? So although the sensitivity of CSF gram stain varies from 60 to 90%, the yield of both gram stain and culture may be reduced because of the recent antibiotic therapy which she was ongoing for UTI. So that's why it can show no organisms on gram stain and culture of the CSF. So antibiotic pretreatment, which was used here in this case for UTI, can also cause high CSF glucose and low protein levels in bacterial meningitis. So patient with high suspicions of bacterial meningitis, even with negative gram stain and culture, should receive full course of antibiotics, and here our answer would be bacterial meningitis. So a common CSF finding in aseptic viral meningitis include the cell count should be less than 500, more than 50% lymphocyte, protein concentration should be little low, 80 to 100, and the normal glucose concentration and negative gram stain. So here, because of the fluid values, the CSF values, we can say that aseptic viral meningitis can't be the answer. Talking about the herpes simplex encephalitis, here there should be abnormalities in the brain function, including altered mental status, but here we said that she is awake and oriented, so no altered mental status. Hemiparesis, there is no history of hemiparesis, seizures, or aphasia, which are common in herpes simplex encephalitis. Moreover, CSF analysis shows lymphocytic pleocytosis, increased number of erythrocytes, and elevated protein. Also, the temporal lobe abnormalities seen on the brain imaging are considered strong evidence for herpes simplex encephalitis, which we do not see here. And that's why here our answer is bacterial meningitis. So just the takeaway point is patients who received antibiotic prior to obtaining CSF levels may have negative gram stain and culture and altered CSF glucose and protein. High suspicious of bacterial meningitis even with negative gram stain and culture warrants full course of antibiotic therapy. Thank you.